Alexander Fleming's discovery of penicillin in 1928 revolutionized the field of medicine and paved the way for the widespread use of antibiotics to treat bacterial infections. This breakthrough not only saved countless lives but also significantly improved global health outcomes. However, what if Alexander Fleming had never made this groundbreaking discovery? What if penicillin had never been found? The potential impact of such a scenario on medical advancements, mortality rates, and global health is profound and worth exploring. Alexander Fleming, a Scottish bacteriologist, made the serendipitous discovery of penicillin in 1928. While conducting experiments at St. Mary's Hospital in London, Fleming noticed that a mold called Penicillium notatum had contaminated one of his petri dishes and inhibited the growth of bacteria. This chance observation led to the realization that the mold produced a substance with powerful antibacterial properties, which he named penicillin. Fleming's discovery laid the foundation for the development of the first antibiotic and marked the beginning of the antibiotic era in modern medicine. Significance of antibiotics in modern medicine. Antibiotics have played a crucial role in modern medicine by effectively treating bacterial infections that were once life-threatening. Before the discovery of penicillin, common bacterial infections such as pneumonia, tuberculosis, and sepsis often resulted in high mortality rates. The introduction of antibiotics revolutionized the treatment of these infections, reducing mortality rates and improving patient outcomes significantly. Antibiotics have also been instrumental in preventing the spread of infectious diseases and have contributed to the overall improvement of public health worldwide. The discovery of penicillin marked the beginning of the antibiotic revolution, which transformed the landscape of medicine and saved countless lives. However, if Alexander Fleming had not made this groundbreaking discovery, the consequences would have been dire. Without antibiotics, bacterial infections would have continued to pose a significant threat to human health, leading to higher mortality rates and increased morbidity. The lack of effective treatment for bacterial infections would have also hindered medical advancements and compromised global health outcomes. In the following sections, we will delve deeper into the potential impact of Alexander Fleming not discovering penicillin on medical advancements, mortality rates, and global health. We will explore how a delayed antibiotic revolution could have shaped the course of history and the implications it would have had on human health and well-being. Medical advancements without penicillin. Before the discovery of penicillin, the absence of antibiotics posed significant challenges in the treatment of bacterial infections and the practice of medicine. In this section, we will explore how the development of medical treatments and procedures would have been affected if penicillin had never been found. Prior to the advent of antibiotics, medical practitioners relied on alternative treatment options to combat bacterial infections. These included surgical interventions, such as drainage of abscesses and amputations, as well as the use of antiseptics and disinfectants to prevent infection. Herbal remedies and folk medicine were also commonly used to alleviate symptoms and promote healing. While some of these methods were effective to a certain extent, they often fell short in treating severe bacterial infections, leading to high mortality rates and poor patient outcomes. Without the availability of penicillin and other antibiotics, medical professionals faced significant challenges in combating bacterial infections. Infections that are now easily treatable, such as pneumonia, sepsis, and bacterial meningitis, were often fatal in the absence of effective antimicrobial agents. The lack of targeted treatment for bacterial infections also resulted in prolonged illness, increased risk of complications, and higher mortality rates. Additionally, the overuse of nonspecific antimicrobial therapies, such as sulfonamides, led to the development of antibiotic resistance, further complicating the management of infections. The absence of penicillin would have had a profound impact on surgical practices and patient outcomes. Surgical procedures, such as appendectomies, cesarean sections, and orthopedic surgeries, carry a risk of postoperative infections caused by bacteria. Without antibiotics to prevent and treat these infections, the risk of complications, such as wound sepsis and systemic infections, would have been significantly higher. Surgical mortality rates would have also been elevated, leading to poorer patient outcomes and reduced confidence in surgical interventions. In conclusion, the development of medical treatments and procedures would have been severely hampered without the discovery of penicillin. The challenges faced in combating bacterial infections without antibiotics would have had far-reaching consequences on patient care, surgical practices, and overall healthcare outcomes. The impact of a world without penicillin serves as a stark reminder of the critical role that antibiotics play in modern medicine and the importance of responsible antibiotic use to preserve their efficacy for future generations. Mortality rates in a pre-antibiotic era. In a world without the discovery of penicillin and other antibiotics, mortality rates would have been significantly higher due to the inability to effectively treat bacterial infections. In this section, we will analyze the potential increase in mortality rates in a pre-antibiotic era and explore the impact of infectious diseases on population health. Historical data comparing mortality rates before and after the introduction of antibiotics provide valuable insights into the impact of these life-saving medications. Prior to the antibiotic era, infectious diseases were a leading cause of death worldwide, contributing to high mortality rates, particularly among vulnerable populations such as infants, the elderly, and individuals with weakened immune systems. With the advent of antibiotics, mortality rates from bacterial infections plummeted, leading to significant improvements in public health outcomes and life expectancy. Infectious diseases have historically played a significant role in mortality rates, shaping population dynamics and public health policies. Before the widespread use of antibiotics, diseases such as pneumonia, tuberculosis, sepsis, and bacterial meningitis were major contributors to mortality, claiming countless lives each year. The lack of effective treatment options for these infections resulted in high morbidity and mortality rates, particularly during epidemics and pandemics when healthcare systems were overwhelmed. Certain infectious diseases would have posed even greater threats to human health in a world without antibiotics. Tuberculosis, a highly contagious bacterial infection of the lungs, was a leading cause of death before the discovery of antibiotics. Without effective treatment, tuberculosis would have continued to spread unchecked, leading to widespread morbidity and mortality. Other diseases, such as bacterial pneumonia and septicemia, would have also posed significant challenges in the absence of antibiotics, resulting in higher mortality rates and poorer patient outcomes. In conclusion, the potential increase in mortality rates in a pre-antibiotic era underscores the critical importance of antibiotics in modern medicine. The historical data comparing mortality rates before and after the introduction of antibiotics highlight the profound impact of these medications on public health outcomes. Infectious diseases, particularly bacterial infections, have long been a major cause of mortality, and without antibiotics, the toll of these diseases on human health would have been devastating. The continued development of new antibiotics and the responsible use of existing ones are essential to combating antimicrobial resistance and preserving the efficacy of these life-saving medications for future generations. Global health implications. The discovery of penicillin by Alexander Fleming had a profound impact on global health, shaping the course of medicine and public health initiatives. In this section, we will examine the broader implications on global health if penicillin had not been discovered on time and the potential consequences for disease control, antimicrobial resistance, and healthcare disparities. The timely discovery of penicillin played a crucial role in advancing public health initiatives and disease control programs worldwide. Antibiotics have been instrumental in treating infectious diseases, preventing the spread of epidemics, and reducing mortality rates. Without the availability of antibiotics, public health efforts to control diseases such as tuberculosis, malaria, and HIV/AIDS would have been severely hampered, leading to increased morbidity and mortality. The absence of effective treatment options for bacterial infections would have also compromised disease surveillance and outbreak response efforts, posing significant challenges to global health security. In a delayed antibiotic era, the potential spread of antibiotic-resistant bacteria would have posed a serious threat to global health. Without effective antibiotics to combat bacterial infections, the selective pressure on bacteria to develop resistance would have been heightened. Antibiotic-resistant strains of bacteria, such as methicillin-resistant Staphylococcus aureus, MRSA, and multi-drug-resistant tuberculosis, would have spread more rapidly, leading to treatment failures and increased mortality rates. The lack of effective antimicrobial agents to treat resistant infections would have further exacerbated the problem, creating a public health crisis with far-reaching consequences. The absence of penicillin and other antibiotics would have exacerbated existing disparities in healthcare access and outcomes between different regions of the world. Developed countries with robust healthcare systems and resources would have been better equipped to manage infectious diseases in a delayed antibiotic era, while developing countries with limited access to healthcare services would have faced greater challenges. The lack of affordable and effective treatment options for bacterial infections would have widened the gap in health outcomes between high-income and low-income countries, leading to increased morbidity and mortality among vulnerable populations. In conclusion, the discovery of penicillin had far-reaching implications for global health, shaping the landscape of medicine and public health initiatives. The absence of antibiotics would have had profound consequences on disease control programs, antimicrobial resistance, and healthcare disparities, highlighting the critical role that antibiotics play in safeguarding public health. The continued efforts to promote responsible antibiotic use, develop new antimicrobial agents, and address healthcare inequalities are essential to ensuring a healthier future for all populations around the world. Conclusion. In exploring the hypothetical scenario of a delayed antibiotic revolution due to the absence of penicillin, we have delved into the potential impact on medical advancements, mortality rates, and global health. The key points discussed underscore the critical role that antibiotics, particularly penicillin, play in shaping modern medicine and safeguarding public health. Alexander Fleming's serendipitous discovery of penicillin in 1928 marked a pivotal moment in medical history, revolutionizing the treatment of bacterial infections and laying the foundation for the antibiotic era. Fleming's keen observation and scientific curiosity led to the identification of a life-saving medication that has since saved countless lives and transformed the practice of medicine. The significance of Fleming's discovery cannot be overstated, as it paved the way for the development of a wide range of antibiotics that continue to be essential in modern healthcare. Antibiotics have played a crucial role in saving lives, reducing mortality rates, and improving global health outcomes. The timely administration of antibiotics has been instrumental in treating bacterial infections, preventing the spread of epidemics, and enhancing patient outcomes. Without antibiotics, the burden of infectious diseases would be much greater, leading to higher mortality rates and increased morbidity. The availability of effective antimicrobial agents has been a cornerstone of modern healthcare, underscoring the importance of responsible antibiotic use and antimicrobial stewardship. The hypothetical scenario of a delayed antibiotic revolution serves as a reminder of the profound impact that medical breakthroughs and research have on human health and well-being. It highlights the importance of scientific discovery, innovation, and collaboration in advancing healthcare and addressing global health challenges. As viewers, we are encouraged to reflect on the significance of supporting medical research, promoting evidence-based medicine, and advocating for policies that prioritize public health and patient safety. In conclusion, the hypothetical scenario of a delayed antibiotic revolution without the discovery of penicillin underscores the critical importance of antibiotics in modern medicine. It serves as a testament to the transformative power of medical breakthroughs and research in shaping the future of healthcare. As we navigate the complexities of healthcare delivery and disease management, let us continue to value and support scientific inquiry, innovation, and the pursuit of knowledge for the betterment of human health and society as a whole.